Welcome back to Fluvoxamine Frontiers, Battling COVID 19, where we are exploring the unexpected journey of fluvoxamine in the fight against a global pandemic. I'm your host, Dr. Soma Rohatgi, joined by our guest, Saakshi Sharma, who has a passion for global health solutions. Today, we are zooming out to look at fluvoxamine's potential to bridge gaps in global health equity, especially in low resource settings. Picture a complex machine, like the human body during COVID 19, breaking down. Fluvoxamine is like a low cost, reliable tool that can fix it even in places where fancy equipment isn't available. As a repurposed drug, it's affordable and accessible. But how does it fit into the global fight against COVID 19? Let's find out. Sakshi, let's start with its potential. Why is fluvoxamine a game changer for low income countries battling COVID 19?
Fluvoxamine's potential in low-income countries is huge because it's a repurposed drug that's both effective as well as affordable. In studies like the Stop COVID trial from 2020, fluvoxamine reduced the progression to severe disease in high-risk outpatients, meaning fewer hospitalizations, a critical advantage where ICU beds are scarce. Its oral administration is another plus. It doesn't require IVs or hospital settings, unlike some other treatments. For example, in small outpatient study in Uganda in 2021, fluvoxamine helped patients recover at home, easing pressure on strained healthcare systems. It's even low cost, often under $1 per day, which makes it feasible for resource-limited settings, unlike expensive monoclonal antibodies. This accessibility can save lives in places where healthcare infrastructure cannot handle surges, making it a lifeline for vulnerable communities.
That's powerful. A simple pill making such a big impact. What barriers exist to fluvoxamine's adoption in these global settings?
Dr. Soma, the barriers are significant, but not insurmountable. One major issue is definitely awareness. Many healthcare providers in low income regions aren't familiar with fluvoxamine's COVID 19 data, as seen in feedback from the Golden Gate study, where some clinicians hesitated due to its psychiatric origins. Supply chains are another hurdle. Even though it's cheap, distribution can be inconsistent in remote areas. Regulatory challenges also play a significant role. Fluvoxamine's off-label use for COVID-19 is not approved everywhere, complicating procurement. Finally, cultural stigma around mental health drugs can deter patients, as noted in some African trials, where participants worried about taking an SSRI. Education campaigns, streamlined supply chains, and even policy advocacy are needed to overcome these obstacles.
So it seems it's about getting that tool into the right hands. How does fluvoxamine's cost compare to other COVID 19 treatments, and why does this matter globally?
Fluvoxamine's cost is a standout feature. A 10-day course can cost as little as $4 to $10 based on generic pricing in studies like Stop COVID. Compare that to remdesivir, which can run hundreds of dollars per course, or even monoclonal antibodies, which are often thousands and require infusion centers too. Even oral antivirals like Paxlovid are pricier and even less available globally. This low cost matters because low income countries often have budgets stretched thin by vaccine and basic care. Fluvoxamine's affordability, as demonstrated in trials in India and Uganda, allows government to treat more patients, reducing mortality without bankrupting health systems. It's a practical solution for equity in global health.
That affordability is like a beacon of hope for fairness in healthcare. Fluvoxamine is the humble bicycle, affordable and efficient, carrying hope to every corner of the world. It doesn't need any fancy infrastructure, just the will to pedal it to those who need it most. Thank you, Saakshi, for highlighting fluvoxamine's global potential. Listeners, keep exploring with us on Fluvoxamine Frontiers. Till then, stay curious. Science is full of solutions waiting to be shared.